A lot of people think of prevention as it applies to primary care, prevention of heart disease or, prevention of diabetes. Um, but in the field of oncology, imagine if we could prevent, cancers in the first place. Well, that would be fantastic. But along that field of prevention is early detection. And then also when someone has successfully gone through a cancer experience, then you also want to make sure that they have as healthy a lifestyle going forward to prevent a recurrence, to prevent another cancer. So the field of prevention and early detection is integral to oncology. It's extremely important. There's been a lot of advances in the field of prevention as it applies to cancers. We can identify now patients that are at high risk for the development of breast cancer, or patients that are at high risk of the development of colon cancer. There's genetic testing that can be done. And so these are individuals that are at high risk but do not have cancer and the cancer may not be expressed until 5 or 10 years. So then we can capture those patients while they're healthy. And there are preventive strategies that can be given to those patients. In some instances, it may involve taking a pill. In other instances, it may involve very close surveillance. In other instances, it may involve different types of detection techniques. Along the way, it's also lifestyle interventions, because I think there is a link between someone being genetically susceptible to a cancer and the environment. So if I am identified as having a risk of developing lung cancer because there's some mutation in me, well, of course, you can intervene if I smoke or educating me or making preventive strategies so that I don't end up getting the cancer and then going to the oncologist. So the whole field of prevention is extremely important in oncology. And when you come into this system, like the GRACE system, that emphasizes prevention, as an oncologist, we're in sync. We're immediately speaking the same language. It may be in a different patient population, but the whole field is second nature to us.